Last patient comes in and says, "Andrew, my knees hurt. They've hurt me for years and they're getting worse. I can't hardly go up and down stairs anymore. I can't walk long distances. Can't do the things I want to do." She went to the doctor and got x-rays, and the doctor told her she had arthritis and that she was probably looking to get a total knee replacement. And so her main concern coming in was she doesn't want to have a total knee replacement. She's not at the point where she wants to have surgery. So is there anything I can do to help? The other patient that comes in, new patient, says, "Went to the doctor, had knee pain, and got x-rays and shows I have arthritis. And he told me I should come to therapy. I don't know why, I have arthritis. I don't know what you're going to do to help." So the question is, what can physical therapy do to help with arthritis? So the arthritis we're talking about here, and in most cases when we talk about arthritis, is osteoarthritis. Osteoarthritis is when the cartilage at the end of your bones starts to break down and it becomes inflammatory, and over time it leads to degenerative joint changes. It's the arthritis that when you look at the x-rays you can see it's fairly obvious usually, especially if it's more advanced, where you can see that the ends of the bones are more rough and they don't have that pristine, smooth character anymore, and the space between the bones is usually narrowed. So that's probably the key thing there, is that when you see those x-rays, and that's what a lot of people say, is that the doctor showed me the x-rays and I could see it. It's really obvious that I have bad arthritis. Interesting thing over the years they found is that just because you have arthritis, that they know for sure you do because they saw it on the x-ray, doesn't mean you have to have pain. So that should be sort of the big aha moment there, is that just because I have arthritis doesn't necessarily mean I have to have pain. And that's where physical therapy can come in and make a big difference. So the question really is where is the pain coming from? And if it's not coming from deep in the joint there where we can see that you have arthritis, is that there are some other possibilities there that physical therapy can address. One is that you have all this chronic buildup of inflammation over the years, and it becomes kind of a swollen mass of kind of thickened tissue that doesn't want to move very well. And that's something that physical therapy that's all about, is function. And so if we have a part that doesn't want to work very well, the mechanics of it, the strength of it, the movement of it, the quality of how well you can use it is no longer 100%, those are the things that we can help with. So what we can do, we can go in and we can work with some of our modalities like ultrasound, electrical therapy, some of our hands-on manual treatments to try to loosen up and break up some of that chronic inflammatory character or tissue, and start to get some blood flow in there, start to get some things loosening up. If everything is moving better and stronger, then it puts less stress across the joint. And then it allows us to take that next step, which is to get the muscles working better. And that's really the big thing, is if we can get the muscles working better, we're gonna promote better function. So we come back to that original question, is can physical therapy help with arthritis? And the answer is yes, but we can't fix the actual arthritis, but we can help. And sometimes we can help significantly. Sometimes we get people who have complete full resolve and have no pain anymore, and they're just blown away, and they're wondering why they didn't come years ago, you know. And even the people who get even a partial improvement, maybe 50%, 60%, they're like, you know, it still hurts to do these things, but it's nowhere near what it used to be. I'm able to do so much more, and it's at a tolerable level now. So those are significant gains, given the situation that we can't directly go in and change somebody's arthritis, but so much of it has to do with function. And if we can get the function of the joint, the mobility back, then that can make all the difference. So if this strikes a chord with you, or somebody you know, a family member or a friend, you know, give it a try, I say. You know, it doesn't hurt to at least explore the possibility. Come by, talk with us, and we can tell you what we think. It's not a guarantee for sure. It's one of those situations where it's a big maybe. You know, is physical therapy going to help with this? But it's a pretty positive outcome potentially that we've seen over and over again, where people are so surprised and happy of how much improvement they have that it's worth a try.